The small West African country, Sierra Leone, was devastated by a decade-long civil war and the 2014 Ebola epidemic. But through it all, the church has been there. The Pan-African Rural Health and Social Service Organization is on the forefront of improving health and education in the country. For more, let's welcome Dr. Sam Komori, who founded the ministry in the pews of First Wesleyan Academy United Methodist Church in Harvey, Illinois. We also welcome Mary Komori, Sam's wife, and the ministry's co-founder. Tell us about Sierra Leone and the challenges it has faced in the past 20 years.
To start with, Sierra Leone went through 11 years of civil war, starting from 1992, 93 until early in the 2004, 2005, when the war actually was completely finished. Now, during those 11 years of civil war, the country was devastated. A lot of problems out there. There was no law and order. People were in refugee camps all their time, or 11 years, taking handouts from, United Nations refugee assistance programs, and they didn't know farming. So after the war was over, the people went back to their homes, and the houses and all their villages were all destroyed. Society was broken. Every cultural fabric was destroyed. There was nothing to look forward to. So we went home and we realized that the country has gone through tremendous things, and there was no hope whatsoever for anybody. There was no school whatsoever. There was no drinking water, no clean drinking water. There was no economic viability for anybody out there, no jobs. We had teen soldiers, that were out there, child soldiers they call them generally. We had all these adults, men and women, who were illiterate, and they had families, that have their own children they can't support because they have no skills. So it was a tremendous economic hardship, no food at all. It was a terrible thing. And then, like that was not enough, the Ebola crisis came in 2014.
Can you please tell us more about that?
The Ebola crisis started, like a joke. People knew nothing about the disease itself. So even the healthcare providers were the ones that were consumed more. They were more destroyed. More doctors died, more nurses died, because they didn't have any idea. But the churches were there. The United Methodist Church actually spearheaded that fight against them.
Mary, can you tell us how you felt being the co-founder with your husband?
Oh, the first time we went home and we saw all this devastation and all the situation back home was just terrible. And I felt very bad, because the little we took them, it seemed like it was just a drop in the bucket. So we came home, I was so tormented. I kept telling my husband, I'm like, I don't know what we're gonna do, but I felt so bad for the people.
What program do you do in Sierra Leone?
In Sierra Leone, we started with many programs, because when we first realized after the war, we could not, it was difficult, I could say. It was difficult to decide what to do and what not to do. There was no food. People were hungry. They didn't have clothes to wear. There was no school at all. The few schools that came into existence, kids did not have school material. They didn't have exercise books or pencils or pens and rulers, and kids were driven from school for a pencil or a notebook. They will expel you, or they will suspend you for not send you out of class for things like that. No drinking water, no clean drinking water. There was no economic development whatsoever. So it was difficult to decide. What we did was, first we started providing people with food, assisting them with the farming so we can produce food. Because if you don't have food in your tummy, you don't have energy to do anything else. So we did that. We helped them with community farming. And then we went on to dig a few water wells in the village, because we had a drill, that the drill went bad, so we stopped that. We were doing outside toilets because there were no sanitary facilities out there. People were going into bushes to defecate, and it rains and it goes back into the stream that they drink, and that causes them diseases that are really preventable. So we are doing, up to now, we're doing outside toilets for these people out there. And then we went also to do vocational training. The young men and women who were like 5, 6 when the war started, the war ended them being 18, 19, 20. Some of them have families, the children they can't feed because they have no skills, no education. So we did vocational training for them. We established vocational training for them. The young girls, we are doing sewing. We have Lucy Kimbrough School of Creative Arts that is teaching the young kids how to sew. We bought sewing machines and send them over there. We have tutors that teach them. They are now doing fabrics, their own fabrics now, so they can make clothes out of that, and they can feed their families. The young men, we taught them to do bricklaying and building, and we were able to establish a school of our own we call Hope United Methodist School. And the church, Hope United Methodist Church, we're using the same building for school and church until we can build a separate church for them. So there are kids there who do not have this opportunity to be educated. So that Hope United Methodist School and Church is giving them the opportunity. The church is actually just not feeding the body, but we're feeding the souls as well.
Mary, can you tell us more about how the Memorial Center got its name?
Yeah, we named the clinic after our youngest son, Henry Momo Comoy, who was tragically killed 2 years ago. We named the memorial after him because he was very involved in the ministry. Even we took him 2 years in a row. He was always there with his dad. He was always in the bushes. He was always with the people. We have some pictures showing him in the bushes with the people, running around, helping them out, trying to see how he can help them. And even the night he was tragically killed, he had just picked up some donations from a lady who had bags, school bags for the children. He had just got upstairs, giving me the key to the van, and 10 minutes later, I got the devastating news. We were so devastating to us. So we decided to name the clinic after him. So his memory, of course, his memory is always going to be in our heart, in our mind. We never forget about him. But we want to see a structure named after him for his involvement in the ministry.
What can the people in the United States, especially here in Chicago, do to help press?
People of the United States have been very helpful. They have been, I give thanks to God for them and the ministry, the global ministry in New York, the Advance, the local conference here, United Methodist Church, and all the Christian communities, because there are other churches that have been very helpful besides the United Methodist Church. So the Christian community generally, I say thanks to God for them, and I pray that the Lord bless them all. We are in need of first support for this clinic, which we have narrowed down, and my wife being a nurse, myself being a doctor. This is our area. We have tackled all the other areas earlier, the food, the schools, all the other things we've done well. We tackled them. Now our area, which is where we're concentrating on. So we need some help with the running this clinic and maintenance, you know, paying our doctors and our nurses and our non-clinical staff. That's what we're focused on at the moment, and we need help with that now. The other area that we need some help in is tractor. Our farming, which is really the root of the helping the community generally, it's been slowed down because we need another tractor. Our tractor broke down and we need another one. Shipment is being a problem, and it still is because it's expensive. So that is the other area. So those three areas I'll highlight who need help in.
Thank you, Sam and Mary Kamori, for sharing your ministry with us. I'm Tisha Mason for Different Drummers and the Greater Chicago Broadcast Ministries. Keep the faith.